Pediatric surgeon. Basically, I operate on children below the age of 15. I operate basically whenever they need me. So I'm working at Levy, Mwanawasa University Teaching Hospital. I've been there since about October of 2019. I'm the only pediatric surgeon there. So I'm on call when and if a child comes that needs surgery. But it's a great team of surgeons that are there, adult surgeons. So we work together whenever we need to cover each other. So it's also a teaching university. So we do a lot of teaching because it's a sister institution to the Levy Mwanawasa University. So by virtue of working in a teaching hospital, you have to be teaching the next generation of pediatric surgeons in my story. So I'm doing a lot of teaching as well. Typical day, so every day we have what they call management meetings. We just come together as managerial staff to talk about the previous 24-hour period, hardships or challenges faced, how can we improve, or what can we do better, always trying to improve the client service. And then patient rounds follow. So we see the patients on the wards, and if anyone's doing any better, they go home. And then certain days in the week, we have a scheduled operation schedule. So mine is Monday. I go to theater every Monday. And then we operate on the little babies in sequential order, try and start with the littlest ones and then get through the day. After that, you see your post-operative patients, make sure they're fine. If at any point an emergency comes while you're doing this, you need to stop and take care of the emergency. The other days, there are clinics. You see patients in clinic, you see patients on the ward, or anyone that's admitted overnight that was stable enough to wait, or someone you had to operate on, you keep seeing them every day. So it's continuous process. And within that, there's like teaching sessions, there's lectures, now Zoom class. So everything comes together. COVID era that we find ourselves in has really complicated everything. It's stretched resources, not only human, but material, which on any given day outside of COVID is can be challenging, you know, so we do what we can with what we have. So we find ourselves having to obviously, you know, defer elective procedures. So we're pushing back what can wait, which is a fine balance, because, you know, you have to analyze every patient and decide, do they have, you know, a waiting time. So if they're stable, can you push them 2 months down the line? And so we can just see how this goes along every day. So we're prioritizing emergency cases, trying to pool resources together, trying to shift around the staff. So for now, surgeons aren't front line, but I think as the numbers improve, all of us will have to go and give support to the ones that are actively working right now. So right now, the surgery department is largely emergency first, and then we take care of the patients that we have to see and that come into us every day and can't be sent home. Yeah, that's what it looks like right now. In terms of equipment, we're still falling short in a way because we can't provide all the services we would like to. We don't really have all the operating tools I need. You know, pediatric size equipment isn't at present available. So it's in the plan of the hospital to sort of acquire it eventually. So for now, I'm sort of limited with how much I can do, but at least there is a plan to get what we need. So work in progress, definitely work in progress. It's good. It's great that we're actually able to now provide this service, to operate on babies at Levy. because previously, you know, children either born at Levy or sent to Levy from the surrounding clinics, Charleston or anywhere else, had to be referred to UTH, you know. So it was a lot of trauma and stress on the parents and the whole system. But now, at least with this new pediatric surgery, you know, unit that I've started available, we're able to help. So not everyone has to be shunted and sent out to UTH. And it also takes pressure off UTH. So it's good that we're able to give the service to those that are immediately around Levy and the wider population. So we're able to help, and little babies born there that need surgery can go right into theater without having to be referred out.